It's health talk time again. Today we will be exploring glaucoma. Watch till the end for simplified explanation. And if you are yet to subscribe to my channel, please do so now. Today we are talking about something very serious, something many people don't discover until it's too late. Glaucoma, the silent thief of sight you must not ignore. What is glaucoma? Glaucoma is a group of eye conditions that damage the optic nerve. And that optic nerve is very important. It is the pathway that connects your eyes to your brain. Without it, you cannot see. Most times, this damage is caused by increased pressure inside the eye. But here's the scary part. Sometimes glaucoma can happen even when your eye pressure is normal. That's why it is called the silent thief of sight. Why should you care? Millions of people around the world are living with glaucoma, and many of them don't even know it. By the time symptoms appear, permanent damage has already occurred. And here's something very important. Vision lost from glaucoma cannot be restored. This is not meant to scare you, but to help you act early. What happens in the eye when glaucoma sets in? Number one, inside your eye, there is a clear fluid called aqueous humor. It is produced continuously by a part of the eye called the ciliary body, then drains out through a tiny drainage angle trabecular meshwork. This balance keeps eye pressure normal and protects the optic nerve. Drainage problem begins when glaucoma starts. The drainage system becomes blocked or inefficient. Fluid begins to accumulate inside the eye. Think of it like a sink. Water is still running, but the drain is partially blocked. What happens next is that there is a rise in eye pressure. As fluid builds up, pressure inside the eye increases intraocular pressure. The eye becomes tense internally. Even though it may look normal outside, this pressure is the main trigger of damage. Damage to the optic nerve. The rising pressure starts compressing the optic nerve. What happens next? The nerve fibers begin to degenerate slowly. Blood supply to the nerve may reduce. Nerve cells start to die, irreversible damage. This is where vision loss begins. Signal loss to the brain. The optic nerve carries visual signals to the brain. As damage progresses, some signals never reach the brain. The brain starts receiving incomplete visual information. Thanks to all my returning subscribers, and if you are yet to subscribe to my channel, please do so now. Types of glaucoma. Number one, open-angle glaucoma. This is the most common type. It develops slowly and silently. The drainage system of the eye becomes less efficient over time. Pressure builds up and damages the optic nerve. No pain, no early warning. Number two, angle closure glaucoma. This type is different and dangerous. It happens suddenly. Symptoms may include severe eye pain, headache, blurred vision, seeing halos around lights, nausea and vomiting. This is a medical emergency. Number three, normal tension glaucoma. Even with normal eye pressure, damage still occurs. This shows that glaucoma is more complex than just pressure. Number four, congenital glaucoma. Affects babies. Yes, even newborns. Signs include cloudy eyes, excess tearing, sensitivity to light. Let's talk about who is at risk. You may be more likely to develop glaucoma if you, above 40 years, have a family history of glaucoma, have high blood pressure, have diabetes, use steroid medications frequently, have had eye injury. And for my African audience, people of African descent are at a higher risk and may develop glaucoma earlier and more aggressively. This is why awareness is so important. Symptoms of glaucoma. Most types of glaucoma have no symptoms in the early stages, but as it progresses, you may notice gradual loss of peripheral side vision, tunnel vision, difficulty seeing in low light. By this time, damage has already been done. How glaucoma is diagnosed. The only way to detect glaucoma early is through regular eye examinations. Tests include eye pressure measurement, tonometry, visual field test, optic nerve examination, OCT scan. These tests are simple, painless, and life-changing. Now, here's the good news. Glaucoma cannot be cured, but it can be controlled. Treatment options. Number one, eye drops. These help reduce eye pressure, but you must use them consistently. Number two, oral medications used in some cases. Number three, laser treatment helps improve fluid drainage. Number four, surgery. This is used when other treatments fail. Treatment is lifelong. Stopping your medication can lead to blindness. Living with glaucoma can be challenging, but you are not alone. You may feel fear, anxiety, frustration, and that is okay. What matters is following your treatment, attending regular checkups, protecting your vision. Prevention of glaucoma. Here's how you can protect yourself. Go for regular eye checks. Know your family history, control blood pressure and diabetes, avoid misuse of steroids. Protect your eyes from injury. Early detection saves sight. Glaucoma does not announce itself. It does not knock. It quietly takes what you may never get back. But now you know better. And when you know better, you can do better. Complications of glaucoma. Number one, gradual vision loss. The most common complication is gradual loss of vision. But here's the dangerous part. It starts from the sides, your peripheral vision. You may not notice anything at first. You're still reading, still watching TV, everything seems normal. But slowly, your field of vision begins to shrink, like looking through a narrow window. Number two, tunnel vision. As the condition worsens, that side vision disappears almost completely, leaving you with tunnel vision. Imagine walking on the road, but you can't see what's beside you. You turn your head constantly, trying to make up for what your eyes can no longer do. It becomes exhausting and sometimes dangerous. Number three, permanent blindness. If glaucoma is not treated, it can lead to total blindness. And this is not temporary, it is irreversible. That is why glaucoma is called the silent thief of sight. Number four, optic nerve damage. The real damage in glaucoma happens deep inside the eye, at the optic nerve. Think of it like a cable. Once that cable is damaged, the signal is lost. And unfortunately, science has not found a way to repair it. Number five, severe eye pain, acute cases. Not all glaucoma is silent. In some cases, especially sudden or acute glaucoma, symptoms can be very intense. Severe eye pain, headache, blurred vision, nausea, and vomiting. This is a medical emergency. Without urgent care, vision loss can happen very quickly. Number six, reduced quality of life. Glaucoma doesn't just affect your eyes, it affects your life. Simple things become difficult. Walking safely, driving, recognizing faces. Number seven, risk of falls and injuries. When your vision is reduced, you may not see obstacles clearly. This increases the risk of falls, accidents, injuries, especially in older adults. This can have very serious consequences. Now, here's the good news. Glaucoma cannot be cured, but it can be controlled. If detected early, treatment can slow down or even stop further damage. Protect your vision, go for regular eye checkups, use your medications as prescribed. Don't ignore symptoms, know your risk factors, especially if you're above 40 or have a family history of glaucoma. Your vision is something you depend on every day. Yet, it's easy to take it for granted. Glaucoma may be silent, but its complications are life-changing. Don't wait until it's too late. Check your eyes. Protect your sight. Thanks to all my returning subscribers, and if you are yet to subscribe to my channel, please do so now. If this video helped you, please like, share, and subscribe to Health Talk with Nurse Nancy. You might just save someone's sight today. Stay informed, stay healthy, and take care of your eyes. I will see you in my next video.